1. What is the primary responsibility of a post-anesthesia nurse, CPAN? A. Administer anesthesia. B. Monitor and assess patients recovering from anesthesia. C. Perform surgical procedures. D. Manage anesthesia equipment. 2. When a CPAN nurse is preparing to discharge a patient from the PACU, which of the following must be assessed before discharge? A. Patient's ability to sit upright and walk. B. Patient's ability to drink fluids. C. Patient's vital signs are stable and they are alert. D. Patient's surgical site is free from pain. 3. What is the role of a CPAN nurse in preventing postoperative complications? A. Administering antibiotics. B. Monitoring for complications such as bleeding, infection, and respiratory issues. C. Scheduling follow-up appointments for the patient. D. Making decisions regarding the patient's anesthesia plan. 4. Which of the following is an essential intervention when a patient exhibits signs of respiratory depression following anesthesia? A. Administering a narcotic antagonist like naloxone. B. Increasing fluid intake. C. Administering antiemetics. Offering oral fluids. 5. What is the purpose of a preoperative assessment by the CPAN nurse? A. To evaluate the patient's response to anesthesia during the procedure. B. To assess the patient's risk factors and determine appropriate anesthesia plan. C. To assess the patient's readiness for discharge. D. To monitor surgical incision healing. 6. What is the correct procedure for assessing a postoperative patient's airway? A. Open the patient's mouth and check for any obstructions. B. Ask the patient to cough forcefully. C. Monitor oxygen saturation levels only. D. Examine the incision site for drainage. 7. A CPAN nurse must report changes in a patient's vital signs, such as a temperature increase above 101 degrees Fahrenheit. Which of the following could be the cause of this temperature increase? A. Hypothermia from anesthesia. B. Infection from the surgical site. Overuse of opioids. D. Low oxygen levels. 8. When mentoring new nurses in post-anesthesia care, what is a key principle of adult learning to emphasize? A. Providing direct answers to every question. B. Encouraging learners to rely solely on theory. C. Incorporating real-life scenarios and hands-on experiences. D. Minimizing patient interaction for new nurses. 9. The CPAN nurse is assessing a patient's level of pain following surgery. Which scale is commonly used for pain assessment in the post-anesthesia care unit, PACU? A. Visual analog scale. B. Braden scale. C. Mini mental state examined MSE. D. Montgomery-Åsberg depression rating scale. 10. Which of the following best describes the role of a CPAN nurse in promoting regulatory compliance within the PACU? A. Ensuring that all medical supplies are accounted for. B. Strictly following infection control protocols and documenting patient care. C. Encouraging patients to eat and drink post-surgery. D. Overseeing financial aspects of patient care. 11. How should a CPAN nurse respond if a patient becomes agitated and restless after anesthesia recovery? A. Give the patient a sedative immediately. B. Reassure the patient and monitor their vital signs. C. Restrict movement and provide a physical restraint. D. Allow the patient to leave the PACU to calm down. 12. What is the primary goal of post-anesthesia care? A. To manage anesthesia-induced complications. B. To return the patient to their preoperative level of health. C. To help the patient sleep. D. To ensure that the patient is ready for discharge. 13. Which of the following is a typical complication that CPAN nurses need to monitor for in the immediate post-anesthesia period? A. Hypotension or hypertension. B. Increased appetite. C. Prolonged anesthesia effects. Skin irritation. 14. Which of the following is a common indicator that a patient is recovering well from anesthesia? A. Stabilized heart rate and blood pressure. B. Lack of response to verbal stimuli. C. Hypothermic temperatures. D. Excessive secretions in the mouth. 15. How should a CPAN nurse handle a patient who is showing signs of nausea after anesthesia? A. Administer an antiemetic and assess the cause. B. Offer fluids immediately. C. Avoid any further intervention. D. Restrict the patient from eating or drinking. 16. Which intervention is most important when caring for a patient with a history of severe allergies who is recovering from anesthesia? A. Monitoring for signs of an allergic reaction. B. Administering steroids. C. Restricting fluid intake. D. Avoiding the use of certain anesthetic agents. 17. What must be done if a patient develops hypothermia in the PACU following anesthesia? A. Apply warming devices and monitor the patient's temperature. B. Allow the patient to rest without any intervention. C. Offer hot beverages to warm the patient. D. Monitor the patient without any immediate intervention. 18. What key principles should guide a CPAN nurse's actions in terms of patient education for post-surgical care? A. Providing clear, concise, and tailored instructions that consider the patient's level of understanding. B. Offering generic post-surgical care instructions to all patients. C. Relying solely on written instructions for patient education. D. Minimizing patient interaction until discharge. 19. Which of the following is a critical assessment item that a CPAN nurse must check postoperatively for signs of potential complications? A. Postoperative nausea. B. Patient's ability to urinate. C. The patient's family history of surgery. D. The patient's blood type. 20. Which action should be taken if a patient's blood pressure drops significantly in the PACU? A. Administer fluids and elevate the patient's legs. B. Administer pain medication. C. Perform an immediate incision inspection. D. Offer oral hydration. 21. When assessing postoperative breathing patterns, which of the following should a CPAN nurse be most concerned about? A. Decreased breathing rate with irregular pauses. B. Rapid shallow breathing. C. Deep and slow breathing. D. Consistent respiratory rate. 22. How should a CPAN nurse prepare for a new admission to the PACU? A. Review the patient's surgical history and anesthesia report. B. Wait for the patient to arrive before doing anything. C. Only focus on the patient's surgical site. D. Avoid preemptive interventions. 23. What is the purpose of the Aldrete score in post-anesthesia recovery? A. To assess the patient's pain levels. B. To evaluate the patient's readiness for discharge based on physical activity and alertness. C. To monitor the patient's anesthesia level during surgery. D. To assess the patient's psychological well-being. 24. The CPAN nurse is preparing for a patient to leave the PACU. What is the most important evaluation before discharge? A. Ensuring that vital signs are stable and that the patient can respond appropriately to questions. B. Checking the patient's surgical site for any signs of infection. C. Ensuring the patient has a full appetite. D. Preparing a written discharge plan. 25. How should a CPAN nurse document post-anesthesia care? A. In a concise, chronological order, documenting all assessments and interventions. B. Only document changes in the patient's condition. C. Focus only on vital signs and exclude subjective patient responses. D. Record observations without interpreting clinical relevance. 26. In terms of adult learning principles, what strategy is most effective when training new CPAN nurses? A. Providing a blend of theoretical knowledge and hands-on practice. B. Focusing solely on clinical practice without theoretical support. C. Teaching through lectures without active participation. D. Assigning reading materials without in-person demonstrations. 27. What is the correct procedure for managing a postoperative patient with excessive sedation in the PACU? Increase the frequency of assessments and provide appropriate interventions based on sedation level. B. Give the patient more sedatives to help them rest. C. Remove all monitoring devices immediately. D. Avoid interventions and let the patient wake up naturally. 28. When dealing with post-anesthesia patients, what is a crucial communication skill a CPAN nurse should demonstrate? A. Clear and empathetic communication to provide reassurance. B. Limited verbal communication to avoid disturbing the patient. C. Rapid communication with the surgical team only. D. Avoiding all communication until the patient is fully awake. 29. What is the primary focus of regulatory compliance in the post-anesthesia care unit PACU? A. Adhering to patient safety protocols, infection control measures, and documentation standards. B. Ensuring rapid discharge of all patients. C. Limiting communication with patients to ensure focus on clinical tasks. D. Reducing staffing to save costs. 30. A CPAN nurse notices a patient has a low heart rate and is not responding to verbal commands after surgery. What is the first step in responding to this situation? A. Check the patient's airway and administer oxygen if necessary. B. Document the condition and wait for the patient to wake up. C. Immediately call for help without performing assessments. D. Increase the patient's sedation levels. 31. When educating a patient on pain management after surgery, what is the most important consideration? Tailoring pain management strategies based on the patient's prior experiences and preferences. B. Focusing only on the use of opioids. C. Encouraging the patient to avoid taking any pain medication. D. Limiting pain management to non-pharmacologic methods only.